World Health Organization is set to declare the Ebola outbreak in West Africa over on Thursday. Liberia, one of the 3 countries affected by the 2.5-year crisis, has been free of new infections since early December. Guinea and Sierra Leone were also declared Ebola-free. Simon McGregor-Wood looks back at the deadly outbreak.
It was the worst Ebola outbreak in history. The official death toll was 11,315, but it's probably higher. Ebola overwhelmed under-resourced health services and cash-strapped governments in Guinea, Sierra Leone and Liberia. Spread by close contact, the disease killed its victims in days. Whole communities were devastated, families torn apart. Doctors and nurses put themselves at enormous risk. So too those tasked with collecting the mounting number of dead. In some areas, ordinary people put fear to one side to care for relatives and friends.
This work is now a normal hospital. This work we do here is that something is between life and death. Even we that work within the various ETU is between life and death because many of our friends contracting the virus.
The international response was slow and badly coordinated. Foreign volunteers did come to help, and some were infected, leading to a kind of hysteria back home, particularly in the US, where presidential reassurance was needed.
Our medical teams here are getting better and better prepared and trained for the possibility of an isolated Ebola case here in the United States. But in the meantime, we've got to make sure that we continue to provide the support of health workers who are going overseas to deal with the disease where it really has been raging.
The epidemic has exacted a terrible economic price in parts of West Africa. Already weakened economies were tipped into recession as farms went untended and whole towns put into isolation, restricting the movement of goods and people trying to get to work. The outbreak re-energized work on finding an effective vaccine, with widespread vaccination programs finally starting in the region at the start of 2015. By then, the rate of infection was falling. Guinea and Sierra Leone were declared free at the end of last year. Liberia has seen no new infections for 42 days, which is twice the incubation period. The human cost of the outbreak has been enormous. Liberia was worst hit, losing 4,800 people. It is the last to emerge from the crisis. The country will be on a heightened state of medical alert for weeks to come. Simon McGregor-Wood, TRT World.